We had our opening day on Wednesday, and we had very engaging panel discussions Wednesday, Thursday, including today. We have a number of them planned. So we want to jump straight into that. Good morning. Once again, I am Samantha Best. We are streaming live on SouthX YouTube channel. You can see us there, as well as we are broadcasting live on Freedom 106.5 FM. So for this morning's first discussion, we will be looking at the topic nutrition security, nurturing healthy habits amid a public health crisis. And with us is Vanessa Martino, public health nutritionist, program manager, nutrition services at the National Schools Dietary Services Limited. And we're so pleased to have her here with over 2 decades of experience in the nutrition field, with a passion for empowering others through knowledge. And currently, again, as I said, serving as the program manager at the National Schools Dietary Services Limited. Welcome, Vanessa Martino.
Thank you for having me.
Also with us is Sharon Denise Hutchinson, and she is a food and resource economist and head of the Department of Agricultural Economics and Extension, Faculty of Food and Agriculture at the University of the West Indies. She holds a PhD in Food and Resource Economics from the University of Florida and a Master's in Science in Agricultural Economics and a Bachelor's in Science in Agriculture from UWI. Welcome, Sharon Denise Hutchinson.
Morning.
And also with us is Ms. Michelle Ash, who is currently the Chief Nutritionist and Head of Division, Nutrition and Metabolism Division of the Ministry of Health. She's worked professionally for over 15 years in the field, and Michelle also works privately as a registered dietitian specializing in diabetes, chronic kidney disease, and bariatric nutrition, as well as additional professional corporate nutrition and dietetics services. Welcome, Michelle Ash. Thank you, ladies, for being here this morning. Really appreciate the time you're giving us. We could jump straight into the topic. Generally, for nutrition security, nurturing healthy habits amid a public health crisis. Michelle, your general thoughts on this particular discussion? Okay, thanks so much. And Sharon, your general thoughts on nutrition security?
Well, I think nutrition security builds a bit on the food security in the sense that in the Caribbean, we tend to have a lot of calories for many people, but sometimes people not looking at what's in those calories. And for me, I'm always focused very much on the availability of nutritious food as well as the affordability of nutritious food, because in the end, it costs individuals and the country a lot of money when people continue to have unhealthy food choices.
Vanessa?
Yes. So one of the components of nutrition security that's highlighted nutrition security is the issue of education, which food security doesn't necessarily speak to. And that is so important because you need to be able to empower individuals to be able to make the right choices. And I'm assuming in the capacity of the school nutrition program, we do both food security as well as nutrition security because with regard to food security, the focus is who are persons that are not food secure. And very often those are the persons who are underprivileged or those who are impoverished, which are the persons we would target from the school nutrition program's perspective. At this point in time, we do about 60,000 breakfast meals every single day and 75,000 lunches throughout Trinidad, not Trinidad and Tobago. And with regard to nutrition security, we do the education part, both to parents and children. You know, that's critical. Nutrition security also talks about persons needing to have access to proper healthcare services to be able to not only meet their nutritional needs, but to monitor their nutritional status or their well-being or health and wellness to ensure that they're fine.
You know, a general a thought that came up when we talked about nutrition security over the past couple of days was who decides the standard for nutrition security? So as a part of the school feeding system, we will say that the government is deciding on that, and then we might say the individuals who are purchasing foods for their homes may be doing that, but then it's really the supply that comes into the country. Who generally makes that decision?
Well, I think it's a decision that has to be made by all parties. It starts with the individual, because the individual needs to know what should be on the plate. All right? And what is this ideal plate? And I know the nutritionist here will be able to say more about that. But when I saw a recent Caribbean healthy plate, it was half with vegetables on it. And for many people, that is not the normal plate for them. And what is the cost of that plate, right? But in terms of affordability, a lot of times we could have some savings because we tend to purchase too much and consume too much, so the portion sizes are too large. So if you could substitute less on the plate for more nutritious options on the plate, that is one way that persons can choose a healthier plate without breaking the bank. All right? And then, of course, persons can also deliberately decide to have healthy options. So, bacon instead of frying and so on. So, there are deliberate choices that the individuals can make. And then, as households also have to make choices for themselves. Especially with young children, you want to inculcate a preference for healthy foods. And that is something children can learn to do as they grow up. All right? Because consumer preferences are a big part from an economic perspective of what drives decision making.
Right. But in general, is there any sort of guidance when it comes to choosing and filling those plates at home for the public, for the individuals?
Yes.
Right. So that would be recent evidence of what you might consider food insecurity in our country.
Yeah.
And Vanessa, what is your organization doing to address nutrition or food security?
Well, as I said before, with regard to food security, the school nutrition program is the largest consumer of food in the country on a daily basis, given the volume of meals we do. In 2013, we would have set up an agriculture department, and members of my department, of that department are here. What they do is we plan menus, we forecast what local produce we're going to be using, and then we collect actual figures on that over the period of time. So I can tell you, like, between 2018 to 2022 fiscal years, that is, we would have spent over $32 million in local produce only. That's actual what have been used on the program. With regard to, and of course, as a partnership with the Ministry of Education would indicate us which students are to be placed on the program. They will do some level of means testing to determine who are the children that should be placed on the program. And nutrition education, again, it's not done by ourselves only. We do have a nutrition department, but we also collaborate with stakeholders like the Ministry of Health as well as even the University of the West Indies. I remember just last week, Michelle calling me and saying there's a health fair they're having, if it's possible that we can join them. Because in countries, in smaller states and within the region, we have to do it collaboratively, we have to do it deliberately, and there is no way we can't do it on our own. We don't all, one organization doesn't all have the resources to be able to get it done. And as you know, the title of the presentation talks about we are in a public health crisis because the morbidity and mortality rates for non-communicable diseases is the highest in our region when you look at Latin America and the Caribbean. So we have a problem and we have to figure out a way to be able to address it.
Right. And Sharon, you know, we hear the term food security. I don't know if you need to elaborate a little more from the panel on nutrition security, but I think a lot of people think this only applies to young adults and children. Is that correct or incorrect?
No, that's incorrect. Food security does take into consideration the availability of food. So what do you have to choose from? Whether it be at the Veggie Mart, the farmer's market, the supermarket. Okay, people shop in different places. What can be produced locally? What can be imported? All of those things affect availability, right? But then there's the accessibility part, which looks at what can you afford. So it could be right there in front of you, but you don't have enough money to buy the product. That's a big issue, particularly coming out of the pandemic where several people, more so women and disadvantaged groups, had a loss of employment or loss of income, and there are many of those disadvantaged groups who have not recovered yet from the pandemic, and their recovery is slower. So the gap, the income gap has actually widened as a result of the pandemic, and that's been a global phenomenon, but also locally, we are seeing that. And women in particular have been harder hit, so there's that gender inequality there as well. So at the University of West Indies, and particularly in my department of Agricultural Economics and Extension, we have various elements that serve this food and nutrition security. So we look at nutrition, human nutrition and dietetics, for example, but we also look at entrepreneurship and agribusiness management. And so we see it as a whole, because in addition to availability and accessibility, now you have to get to utilization. How do you actually use the food? And food safety issues come into play there as well. So if you have a product, let's say fish, are you going to choose to fry the fish, steam the fish, broil the fish? These are deliberate choices that households have to make, because we all know that battering it up and frying it tastes good, but it's not necessarily the best option all the time, right? So if you're going to be having fried everything, that's going to be a problem down the road. And then, of course, the stability. This is where you're looking at economic shocks potentially impacting on food supplies. For example, the Russian-Ukraine war. We've seen the impacts of that through higher food prices. But more importantly, climate change issues, which we still have to take more seriously in the region, because we expect to have lower rainfall, higher temperatures. That's going to affect the availability aspect. All right, and then with storms and so, you could have disruptions in shipping, direct impacts on production and so forth. So we have actually, as she's mentioned, collaborated together to have nutrition education. Our students have gone out on various nutrition fairs, whether it be on campus or in the public, and we like that kind of collaboration with the Ministry of Health and with NSDSL. So we are partners in this. But I think it always surprises us, we still do not have a food and nutrition security policy in Trinidad and Tobago. It has been worked on several times over the years, and it just has not been passed in the cabinet. And without that holistic policy, it means that you don't have a direct vision as to where the country is going to ensure nutrition security for its people. So you might deal with different aspects, but it isn't coming together as it should.
Exactly.
Yeah?
And then in terms of that, if you don't have a nutritious diet, and we're looking at the individuals and we're looking at the households, what is the cost to our society in the larger aspect of things?
Well, certainly health costs will be coming on stream with NCDs. And when you talk about health costs, it isn't just the cost of health care to the individual. You also have lost work days.
Yes.
Poor health, have a loss in productivity. So you might be at work, but not being able to work efficiently. And then there's the cost associated with caregiving. Sometimes the caregivers are other persons in the home
Correct.
who have to also lose work days to care for this sick person, right? And then, of course, the hospital care aspect, the cost to provide for doctors and so on. It's very, very high, and it's affecting children more so now. So, and I know the others can speak more to that, but from a cost aspect, I think we should be alarmed at the cost of healthcare in treating with NCDs that are preventable.
I think that will lead straight into Michelle. Maybe you could share some aspects on how that affects our healthcare system, the lack of maybe a nutritious diet. The lack of a nutritious diet. Yeah.
Amen. Yeah. Yeah.
And as you talk about the situation that came out and the discussions that came out of COVID with regards to meals, I remember it did relate to the schools, in fact, where they were very concerned that when they decided that they may stop the school feeding program, that some people were saying, a large part of the nation, that some of these children, this was the only meal they were getting
Yeah.
for the day, and how does that impact us as a whole, as a society there, Vanessa?
Well, it's interesting that you make that point. During the lockdown, and I can tell you for the fiscal year 2021, we did less than 2% of the regular allocation of meals. And that's when we started to come out of lockdown and secondary school students were back out of school. And we would have had a donation of meals in May, 7,300 meals that our caterers would have donated to impoverished families, and we distributed it through the MP offices. I do think, and Misha can bear me out on this, some of the effects I think we will see later on, meaning that you would have um, deficiencies like iron deficiency, some of the micronutrient deficiencies, which would impact on children's ability to learn in some instances. We may not see it now, we may see it later on. And we would have known that those children would have had a very difficult time, as Michelle was pointing out. We did try to see if we could have distributed meals, but the concern was spreading the virus. So from a health and from a perspective of protecting the health of the population, it wasn't done. But we are so grateful that we're back up now in terms of the meals that we're doing before. The children, we may very well, because when they would have been, if they assess later on, they may see that those deficiencies would impact on their ability, their cognitive development, and even their ability to perform at school. Because some of them would have been out of school for some time, as you're aware, because of the fact that they would either have been online or doing packages, doing work at home. But yes, so that's a concern still.
Thank you
We're still
very
looking
much,
to see.
Vanessa. And as we basically put a wrap on nutrition security, nurturing healthy habits amid a public health crisis, I would love to get some final words from everyone. Anything we may have missed, Sharon?
Well, I think I want to put a plug in again for government stepping up to really focus on nutrition security.
Yeah.
I think it's been sort of talked about very superficially, but having the policies in place really focuses the nation, and it allows us to get funding to do a lot of the developmental work that we have to do, whether it be education programs, sensitization programs, etc. And then it also allows you to channel your resources. So there's a lot of discussion around the world about things like appropriate nutrition labeling. We don't have that here. There are many products you pick up, you don't know what's in it. You can guess, but that is not appropriate at a time when you're trying to help people make the right choices, for example. Some countries have gone ahead to use color codes on their foods. Green signifies, healthy choice. Red is, high calorie or high sugar, high salt, etc. So I think, and sometimes it's deceptive. You're not sure how much sugar or salt is in a product or fat by just looking at it. So we have to help consumers make better choices.
Yes.
And I believe the policy will help that because it will insist on making the information available so that people are not unaware when bad choices are being made. And I also think we need policies to ensure that it becomes more affordable for the average consumer to buy fruits and vegetables, for example, right? Because that's the one thing really missing on the plate. And that's something that you can't substitute out fruits and vegetables for anything. There's no substitute for that, right? So if it's one thing I could say, and I mean the research and development that we're doing at the University of the West Indies does provide information, but we do need that political will to make these necessary interventions happen. Because many other countries in the world have gone ahead and adopted their policies, and they've been able to use those policies to make actual tangible changes in their countries. So we are a bit far behind where that is concerned. So that would be my main point.
Thank you so much, Sharon.
Thank you.
Michelle?
I'm happy to hear that. Yes, we have research.
Okay.
Yes.
That's some good two cents, as well. Vanessa, your final thoughts on nutrition
Right.
security?
I just want to reiterate what both Sharon and Michelle are saying. We do need a food and nutrition policy, a food and nutrition security policy for our country. The survey that Michelle is talking about will provide an evidence-based approach to some of the strategies that we need to deal with. Because at the end of the day, policies like that, they protect especially the vulnerable. They make food accessible to those who cannot get it. They make services available to them because it is written as part of the policy and it is done. And therefore, if that takes place, we can look forward to having a much healthier nation. The reality at the end of the day, the cost of health is not the cost of just treating the person, but the levels of productivity, the days man hours lost. And the challenge is it's not only affecting our adults, it's affecting our children. And we want to be able to create a better future for them. And if we have both and even a school health policy, I know that Misha would have done, they're looking at doing that, but you need an overarching policy that would help to streamline the efforts that you made. For example, in 2017, both the Ministry of Education and the Ministry of Health would have banned sugar-sweetened beverages in schools, and they're still to implement other standards. But it's always, we say we are swimming up against the tide because you go to schools and you still have in cafeterias, which are available to students, snacks and foods that are high in sugar, salts, and fats that don't impact health, that don't impact on their health. So we teach them one thing in the classroom, but the supportive environment is not there. And we want to be able to do that. And securing such policies and having that survey done would give us strategies to be able to get those things done.
Thank you very much,
welcome.
Vanessa Martin, Sharon Hutchinson, and Michelle Ash. We definitely are so happy that you had the time to come and share your insights with us when it comes to nutrition security, nurturing healthy habits amid a public health crisis. You're here at the Caribbean Food and Beverage Event 2023 at the Center of Excellence. A reminder that we are streaming live on YouTube at the SouthX channel and on Freedom 106.5 FM.